initially considered as a severe respiratory distress, and then when it was recognized that it has all features which should be taken into clinical protocols or revised on the later stage. Of course, we faced this shortage of human resources, especially at the initial state of the outbreak, because majority of health workers were attracted from the primary healthcare level, and but unfortunately at the secondary level, in the level of hospitals, psychological involvement of civil society and volunteers to the response activities, because due to the shortage of human resources, at some stage even students of higher medical education institutes have been attracted, and even here you can see the peak of the June and July 2020 was peak of the outbreak and pandemic in Kyrgyzstan, and the map shows that all regions of Kyrgyzstan were affected by the COVID-19. So the immediate response activities of the COVID-19 was creation of the Command Coordination Center, we call it SHTAB, which was under the Ministry of Health, in order to reduce kind of panic condition among the population. It was decided to strengthen the media and press center of the Ministry of Health, and a spokesperson was appointed who was reporting current health status of the country, and with the focus on number of registered cases, new registered cases, number of patients hospitalized, and successfully treated patients, and death. Immediately they started revision of normative documents in order to support some changes of the healthcare system in order to make it resilient, and to issue some documents which allow to reallocate funding. On parallel, Ministry started building of new healthcare facilities. Unfortunately, at the later stages, after 2 years investigations, we found that some of these efforts were not planned well and successful. Somehow at that time, these new facilities solved the issue, but in general, the statement was to converse the existing healthcare facilities is much more efficient than building a new healthcare facilities from the basement. Ministry organized scientific and practical teams of experts for revision of clinical protocols, because at that time every day we were receiving new information on treatment regimes, and all protocols should be updated. They started conversion of hospital wards and departments, and organized so-called red zones, which were launched based on existence of relevant equipment, relevant trained staff, sufficient stockpile of medicines, and with some experience of coping with such kind of influx of patients. Ministry of Health also was leading in the distribution of humanitarian aid, capacity building and retraining, psychosocial support for the communities, for health workers, and opening daycare centers jointly with city administrations. In the large cities, daycare centers were organized with the proper financial support and equipment was sufficient. And supply of medicines and medical items were somehow coordinated with all stakeholders. I mean, with private, huge pharmaceutical companies importing drugs and medical supplies to Kyrgyzstan. And these are some snapshots from that time, how these daycare centers were organized, how volunteers were involved to the response activities. Sometimes these centers or red zones were organized on day-night shift basis for 24/7. And the next slides we will stop on some consequences of these approaches. Okay, lessons learned. We found